we went digital much before this digital became the buzzword. And as I just explained to you, our journey on the digital side has been more than 20 years now. And whilst it will be wrong to say that we have reached where we wanted to reach or where we want to reach, there's always a better, place to reach and improvise our systems and our solutions. I should say that we are really big on digital, as I just explained to you. All these decision support systems using personalized data and stuff, bringing all the clinical evidence from around the world together in the system. I mean, we are using the technology to our advantage in many, many different ways. But if I have to ask you, if I have to answer your question, specific question, so how are we using this Digital India initiative, or how that becomes a part of our strategy? Let me give you a very specific example. And let me pick an example from the education side, just for the sake of variety, right? I've been talking about clinical solutions. Yeah. So let me add a little more variety to the whole thing. I briefly mentioned about personalized education. So how do we do that, right? So we need to have a platform where everybody comes together, where we are able to capture the details of individual student, where they are, their pre-assessment and post-assessment, all of these doesn't happen. So we have a product called Clinical Learning. It's not a product, actually a solution called Clinical Learning, which is conceived in India, designed in India, developed for India, and is being sold across India. And I can tell you that more than 20% of the medical schools in India are already using that product.
Okay.
Yeah, and everywhere where we have we have made this solution available, both students and faculties just love it. Why they love it is because it makes the whole thing easier for the teacher, right? So if I have to explain the anatomy of heart, what is the structure of a heart to a 17-year-old who has never seen a heart? So seeing is believing, right? We always say seeing is believing.
You've been through that process, right? First year anatomy, fresh out of school.
Absolutely.
You don't know what it looks like. You believe whatever has been told to you.
So you're a teacher. You tell me, well, heart looks like this. So okay, heart looks like this, but heart doesn't look like that. How do I ensure that I'm actually able to tell each and every student and ensure that they understand what the heart looks like and why it does look like that and how that impacts the functioning of the heart, and therefore normal functioning and abnormal functioning of the heart, and then how to then go about treating ailments in the heart.
Correct.
So the foundation is in the anatomy. Now how do I do that? Visualization becomes the key thing. And visualization not just in two dimensions, so you show the cross sections or the longitudinal section. It's actually visualization of how the heart is working. Rotate it 3-dimensional, expand it, make it smaller, rotate it. All of those fancy things that you can imagine in order, if you have to understand how anything looks like, even if you buy a pair of shoes, it's a very nice pair of shoes. Even if you have to buy a pair of, you want to look at it from beneath, from inside, from outside, every side, and to understand, how it is. It's the same thing, even more complex, when it comes to understanding, when it comes to actually implementing those things. But the solution actually does that, and it integrates. So visualization is one part of it. The second part is integration. So as I said, structure, then functioning, normal functioning, abnormal functioning, and managing that abnormal function to make it happen normal again. How do you do that? This whole integration of anatomy, physiology, whatever, biochemistry, then pathology, then microbiology, and then bringing medicine into picture and taking it to surgery. This solution does that. It makes the teaching and learning of medical subjects fun for the student. Faculties can customize it to use in their lectures. They can use it piecemeal. They can run those as modules. They can use them as a whole. They could just slice and dice parts from here, and create their own modules. They could add their own assessments to it. They can do it in n number of ways. Likewise, for a student, they can use it in the lectures, in the classroom, and the faculty are showing them. They can use those for practice in their hostels. They can, they can use those in the library. They can use this on their mobile on the go. They can use it to revise concepts before the examination. They can try assessments before they can do it in an n number of ways again. So that's a very good example, from our side, what we are, doing in the digital space and how we are aligned to Digital India initiative. But as I said, we went digital much before this digital became a buzzword. So it's actually ingrained in our DNA.